Attention guests, our program will begin in 5 minutes. Please take your seats. Attention guests, please take a moment to silence your mobile devices. As a safety precaution in the unlikely event of an emergency, please locate your nearest exit. Our program will begin momentarily. Thank you and enjoy.
Good evening, everyone. Welcome to the University of Nevada, Reno School of Medicine White Coat Ceremony. I'm Sheree Singer, the Associate Dean for Student Affairs. As we begin this ceremony, we acknowledge that the University of Nevada, Reno is situated on the traditional homelands of the Nama, Northern Paiute, Washoe, Washoe, Nuwa, Western Shoshone, and Nawa, Southern Paiute peoples. These lands continue to be a gathering place for Indigenous peoples, and we recognize their deep connections to these places. We extend our appreciation for the opportunity to live and learn on their territory. I am honored to welcome all of our guests, most importantly, the class of 2029, to this very special occasion. We are joined today by many distinguished individuals. Please welcome from the Nevada System of Higher Education, Chancellor Matt McNair, Regent Heather Brown, Regent Carol Del Carlo, the University of Nevada, Reno President Brian Sandoval, our keynote speaker, Dr. Rita Redberg, and welcome to the faculty and staff, including department chairs and leadership from the University of Nevada, Reno School of Medicine. Welcome also to Renown Health. The Renown Health Partnership provides the clinical training needs and experiences to our students and provides the Northern Nevada community with excellent care. And to the families, spouses, and partners, friends who have supported these students, thank you. Your encouragement and belief in them helps bring them to this moment, the beginning of a profound and challenging journey in medicine. Let's have a warm round of applause for everyone joining us today. And now, it's my pleasure to invite to the stage the Dean of the University of Nevada, Reno School of Medicine, Dr. Paul Hauptman.
Dr. Singer, thank you, and welcome everyone. This is a special day because it signifies the first tangible step in a long and complex path to becoming a physician. I'm estimating that 45 months and a few days from now, we will gather together for a very different occasion, commencement for the class of 2029, your class. So how do we get from today to commencement and beyond? I'll offer a few suggestions and thoughts about this excursion from first-year medical student to an individual in whom patients will place their trust. Many years ago, it was said that all first-year medical students on their first day should undergo a procedure, an endoscopy, a bronchoscopy, a colonoscopy. Now, why would anybody say that? Because it's important to always remember what patients go through, to expose ourselves to the procedures and the prodding and poking to which we subject our patients, to the anxiety and worry that patients experience. But have no fear. I was speaking theoretically and maybe a little bit hyperbolically. Your first day of class will be a traditional first day of class. However, it is true that the combination of medical knowledge and empathy will ensure that you will have a successful career and that you will make important contributions to the patients you serve, including many of us in the audience today. In that context, I would like to address the relationships that you will have with patients. Recently, I came across an interesting LinkedIn posting that demonstrates a truism. Knowing your patient has intrinsic value, both for the patient and for you. Indeed, anything that can move us away from templates and the EMR screen and towards the patient should be seen as a must-have. In a tribute to a young 46-year-old emergency medicine physician who had an untimely death, a colleague named Graham Walker wrote the following, quote, "I need you to know just how empty the world is today without Brian in it. In this world of quiet quitting, phoning it in, and doing the bare minimum, Brian was always the opposite. No matter how simple the case, how many thousands of times he'd sewn the same laceration or took the same chest pain history, Brian found a way to make it unique, educational, and interesting for himself, his patients, and his learners. There were numerous reasons why I loved working shifts with Brian. He was a trusted colleague, and we ran many resuscitations together and shared so many laughs, but most of all, I loved overhearing Brian dictate. Brian would intentionally add little details to his patient notes to just add some spice of life to them, to turn the note from a disease or a chief complaint into a person. Let me repeat that. To turn the note from a disease or a chief complaint into a person. Here are some examples. Has been married to his wife of 35 years. They met at a Dairy Queen. Was playing goalie when she fell down and their team was winning 6-0. Just got back from Japan and loved the Kyoto temples the most. Dr. Walker continues, Brian gave 100% every single time to every patient. He had a true, sincere, egoless kindness and warmth that I can only dream of. So after reading that, I felt I knew Brian and that Dr. Walker's message would translate to the white coat ceremony. You can learn a lot from your patients. They are not just an interesting case about an interesting presentation of an interesting symptom. No, each patient is a human being with feelings, mostly anxiety in medical settings, with a family, with hobbies, a personal history, and so much more. Over the years, I've learned a lot from farmers in eastern Missouri and southern Illinois who told me about the process of selecting how much soy versus corn to plant during planting season. From a gentleman who shined shoes at an Neiman Marcus who regaled me with tales of quirky individuals who would show up every single day with a different pair of shoes so that he could shine them. From a woman who worked in a Kraft American cheese factory who taught me that the cheese tastes different depending on the time of year because the feed the cattle are fed changes according to the time of year. From a young man with congenital heart disease who, after receiving a heart transplant, traveled to remote areas of the world and came back with tall tales, which he gleefully shared with me. And from a young woman living in a poor neighborhood in East St. Louis who, after receiving a transplant, obtained a degree in social work and dedicated herself to work with at-risk youth. These are individuals who underlie the reason that I ask medical students, residents, and colleagues to avoid using phrases like the cancer patient, or the diabetic, or the atrial fibber, or worse yet, naming the patient by his or her geographic location, as in, room 6 needs an x-ray. It is and should always be the patient first, the patient with cancer, the patient with diabetes, the patient who has atrial fibrillation. The lesson here is that learning medicine and learning about people are intrinsically intertwined, and that both are part of the privilege of the profession you are preparing to enter today. And so as you leave the Nightingale Theater, do what you can to make joyful connections with your classmates, the faculty, and of course, your patients. And with that in mind, I'd like to address competition. So let's start with an exercise. Each student, please look to your left. The other left. Now look to your right. Look in front of you, except if you're in the front row. Look behind you, unless you're in the back row. These are your classmates, not your competitors. These are your future colleagues, not challenges to your plan to become a physician. Be collaborative, work together, respect the opinions of others. Remember that once you enter clinical practice, you'll be working with a team, and you will only succeed if you do not compete. If you collaborate with your colleagues, with nurses, with pharmacists, physical therapists, and PAs and occupational therapists, and other members of the care team. You must know that there will be a lot of difficult days ahead as well, a lot of studying, pressures related to exams, meeting your first patient, seeing people die in front of you. But you are here for a reason. You have a mission. You are resilient. You have a desire to help others. You want to learn and then impart knowledge. It is the same with every member of the faculty with us today. We are all part of this special school, at a special university, at a special time in medicine, all committed to fulfilling our vision of a healthy Nevada. And that is why we are so glad you are here, and why we look forward to working with you for the next 4 years. It is also true that your family, spouses, partners, and friends are here this evening will be a significant part of your support system and success. So I would like to personally thank them for being in this beautiful theater with us and for being a part of your team. So how about a round of applause? And now it is both a professional and a personal honor for me to introduce a very special white coat speaker. I almost do not know where to begin. Dr. Rita Redberg is a preeminent cardiologist and professor of medicine at the University of California, San Francisco, who practices general and preventative cardiology. A graduate of the Perelman School of Medicine at the University of Pennsylvania, she completed residency in internal medicine and a fellowship in cardiology at Columbia University Medical Center, and a fellowship in non-invasive cardiology at the Mount Sinai Health System. She also has a master's degree in health policy and administration. She has received funding from the NIH, was a founding member of the American Heart Association's Women in Cardiology Committee, served as a Robert Wood Johnson Health Policy Fellow, a staff member for Senator Orrin Hatch, and is an advisor on multiple commissions and committees related to Medicare policy and coverage decisions. In her research, Dr. Redberg has focused on the assessment of safety and effectiveness of medical technology. From my perspective, partly as a former journal editor myself, her biggest impact has been her remarkable 15-year tenure as editor-in-chief of the preeminent publication, JAMA Internal Medicine. She spearheaded the journal's new focus on healthcare reform and, importantly, the less is more medicine movement. With that focus, JAMA Internal Medicine became my absolute go-to journal so that I could learn and think independently and with purpose. On occasions too frequent to count, JAMA Internal Medicine provided critical assessments of what we do and why we do it, or why we shouldn't do it. As you will no doubt see soon, less is more. And in a patient-focused practice, sometimes and maybe often doing less is the correct answer. Clinically, as a preventative cardiologist, she's had a major impact. There is just something that resonates when you dedicate yourself to preventing and or slowing down the progression of heart disease, when you frame shift our focus from the cath lab and intensive care unit to an intentional effort to prevent end-stage disease. With all that said, if I'm not mistaken, Dr. Redberg, this is the first time we met in person, but that may have to do with the fact that you were born in Brooklyn and I was born in Manhattan, which no doubt explains a lot. In any event, I ask everyone in joining me to welcome our white coat speaker who cut short her vacation to be with us today, Dr. Rita Redberg.
Thanks so much for the warm welcome, and I'm so delighted to be here. I'll add my welcome to the distinguished faculty, honored guests, proud family members, and especially the remarkable men and women of the entering class of the University of Nevada, Reno School of Medicine. When I was a young medical student, I went to my chief of general internal medicine at the University of Pennsylvania, John Eisenberg, and asked him if he had any research projects that I could work on. He said, yes, I'm doing a project which involves sending notes to all of the trainees who have ordered routine lab tests, such as serum chemistries, on the hospital inpatients. The notes he sent had questions such as, what did you learn from this lab test? How did it change the management of your patient? Could you have made those changes without these lab tests? I asked him about the purpose of this research, and he explained that he thought doctors ordered many tests, and at least some of them were not necessary, as they were not helping patients. He explained that there was actually a lot of over-testing. I was surprised to learn this, as I had assumed all of the lab tests and most of the medical practice that I had observed so far was done because it was known to be good for patients. But he seemed to be questioning the judgment of doctors. He explained that he just wanted to learn and to try to change physician behavior in order to improve patient care. So we monitored whether there was a change in lab test ordering behavior after a few weeks of sending these daily notes. Much to Dr. Eisenberg's frustration and my surprise, there was no impact on lab test ordering behavior. But there was a big impact on me. Dr. Eisenberg explained to me that there was no evidence of benefit from many of the tests we ordered, and I thought a lot about that through the remainder of my medical career and how I could do better. So in 2010, as Dr. Jean Hauptman mentioned, I launched the Less is More series at JAMA Internal Medicine, where I was editor-in-chief. And it was through that work that I met Jean Hauptman, as well as many others through their writings, not in person. This series is founded on the principle that sometimes less healthcare can be better for you. All healthcare has some chance of harms, and if there is no known benefit to that healthcare, all that is left is the chance for harms. And the only way you can measure the value of a test is whether it has a reasonable chance of helping the patient. There are many possible tests we can order, and they all offer some information. But the important point in deciding whether to order it is, will that blood test or CT scan or procedure actually help the patient in front of you? If you cannot answer that question affirmatively, strongly consider not ordering that test or procedure. I realize that not ordering a test is hardest to do at your early stage in your career, as the default position in our medical system is often to do something and not to question whether it is actually helpful or necessary in patient care. The white coat that you will receive shortly is not a garment, so much it is a symbol and a reminder of our immense responsibility in this revered profession, which is dedicated to healing and humanity, which you are all entering. The coat means a lot to your patients, as it symbolizes professionalism, caring, and trust, all of which we must earn from those we serve. Medicine is not just a science, it is also an art. As Sir William Osler stated, the good physician treats the disease, the great physician treats the patient who has the disease. It is in the vulnerability of patient encounters, the sharing of stories, the healing touch, that the true essence of medicine is learned. And it is in these moments that you will begin to understand the skills needed to be a warm and compassionate doctor, in addition to all of the important science you will cover in the classroom. So as you begin your own journeys, remember the core qualities that define a great physician: the ability to listen with empathy, integrity, ethical responsibility, and a relentless pursuit of knowledge. Listen to your patient's stories and be able to put yourself in their shoes and advocate for their well-being. And remember that helping a patient does not always mean ordering a test or a procedure. As their doctor, your caring and alliance is often the best therapy and reassurance we can offer. Do not treat the lab test or a finding unless there is meaningful benefit for the person that that test belongs to. And don't order the test unless there is a reasonable chance it can help your patient to feel better. Of course, there are many things we can do to help patients feel better, and treatments are just part of them. People who were strangers 5 minutes before entering your office may soon trust you with their deepest secrets, and we want to take the best care of them possible. You will be looked to immediately as an authority of medical care, so choose your words carefully and the tests that you order wisely. I can't tell you how many times a patient has said to me, I really didn't think much of this little twinge I had in my arm or my chest, but I went to the emergency room and they ordered a stress test or an EKG, and now I think, oh, when I get that twinge next time, I better go again because the doctor was worried enough to order a test. Of course, sometimes it's totally appropriate, but just important to think about. I'm very grateful to be able to be a doctor. It is, I think, the most rewarding profession to be able to listen to people's concerns, their symptoms, assess their overall situation, and offer them advice and reassurance, treatment when helpful, and then have them return and say how much better they're feeling. And being in academic medicine, to me, is the best of everything, as I get to still take care of patients, teach our trainees, and continue to do research aimed at improving our healthcare system. So every day is a little different and really fun. I see our job as doctors as helping patients to feel better and/or to live longer. Yet we have the most expensive healthcare system in the world, by far, and Americans do poorly on many common health parameters, such as life expectancy, maternal and fetal mortality, and access to health care. I think the reason for this poor return on our healthcare dollar investment is because we are too often not thinking about if the test, the chemotherapy, the CT scan, or ICU care is actually in the patient's best interest. My current research focus now is the medical device industry, which has grown increasingly rich and powerful in the last few decades. Yet many medical devices, even high-risk ones, are allowed on the market without evidence that they help patients to feel better or live longer. And there are strong incentives to do even unnecessary device-based procedures, which are reimbursed much more highly than medical management or talking to your patient. So just keep the evidence for patient benefit in mind as you go through your medical training, as there are numerous forces and examples you will see that are not in a patient's best interest. You're entering the profession at a remarkable time, a time of unprecedented technological advancement and innovation. Artificial intelligence, personalized medicine, virtual care, and 3D printing are all revolutionizing diagnostics, treatment, and patient care. These tools will empower you to deliver more precise, efficient, and effective care, but they are no substitute for the human touch. Person-centered care based on human connection remains at the heart of healthcare. So embrace this journey with an open mind and a compassionate heart. You can lean on your mentors and colleagues, learning from their wisdom and experience. As Dean Houtman said, cultivate a strong support network of peers, for you will need each other in the challenging years ahead. And I saw it, frankly, already starting this morning when I saw a lot of you out playing ball and even getting ready to come in here, so you're well on your way. And never forget the initial spark, the why that led you to medicine, your desire to heal, to help, and to make a difference. Today, the entering class is welcomed into a legacy of healing, a profession built on trust, compassion, and a commitment to serving humanity. So congratulations as you don your white coats to signify the start of this exciting journey and begin your path to becoming a doctor, a hallowed and rewarding profession. And great work on choosing medicine and being accepted to this great medical school. You are now on the path to be able to help so many people and make a difference in their lives. Thank you.
Thank you, Dr. Redberg. Now, I have the pleasure of introducing Dr. Aaron Derringer, Assistant Dean for Admissions, to the podium so he can introduce you to the class of 2029. Dr. Derringer.
Thank you, Dr. Singer. It is now my honor to introduce to everyone the next incoming class of UNR Med, class of 2029. So the white coat ceremony is actually my favorite event of the year. For you, it represents many years of dedication to preparing for acceptance into medical school. But for my team, this is really the culmination of almost a year-long process of getting to know you just by an application on a computer screen to actually sitting here today, getting ready to receive your first white coat. Reaching this point was made possible by the hard work of an amazing admissions team, a very dedicated admissions committee, and many others of our UNR Med family. So I would personally like to extend a thank you to each and every one of them for their continued dedication to UNR Med and in bringing you this class of future doctors. So thank you. Now, before we have you don your white coats, it's a tradition here at UNR Med to share with everyone some of what we've already learned about your class. So this year's class comes to UNR Med after completing undergraduate degrees at many different institutions, including UNR, UNLV, many of the UC schools, including Berkeley, Davis, San Diego, Los Angeles, as well as Stanford and Cal Poly, and also from coast to coast from the University of Arizona, Utah, Oklahoma, Washington, Rochester, Colorado, Pennsylvania, among many other undergraduate institutions. You have shown strong academics in a wide range of majors, some of which include biology, chemistry, neuroscience, psychology, engineering, public health, media studies, and even construction management. Many of you have grown up in Reno and Las Vegas, but we also welcome students from many of our Nevada rural communities, including Elko, Battle Mountain, Fallon, and Minden. This year, we are also welcoming 2 students who have been admitted both directly to our MD program as well as a PhD program at the time of starting medical school. They will be working with world-renowned biomedical research faculty here at UNR Med to become the next generation of physician scientists, earning both their MD and PhD degrees at graduation. Prior to medical school, many of these students worked in the healthcare field in jobs such as medical scribing, ER techs, nurses, EMTs, medical assistants, but some of you have maybe had considered non-traditional jobs on the path to medicine. We have a Korean barbecue server, tennis coach, a wilderness excursion guide, as well as a professional cheerleader for both the NFL and NBA. They all have a passion for outdoor activities, like you expect, skiing, hiking, camping, pickleball, rock climbing, along with some more hobbies, like cooking, painting, piano, Latin dancing, and even a couple of budding amateur herpetologists who own bearded dragons. Now, this is just the tip of the iceberg of all the experiences you will bring to UNR Med. And we look forward to learning more about each and every one of you over the next 4 years. And hearing from the student who's restored a 1968 Camaro, which I think is appropriate because Hot August Nights has returned to UNR campus, so maybe we have an entry into next year's event. Let's see, one of you shared that you have perfect pitch. We have somebody who's perfected a juggling routine. I'm sure if that's objects or you've learned how to juggle everything that might come with medical school in terms of testing and studying, so it's likely a good skill to have. One of you is approaching 1 million minutes on Spotify, and I actually had to calculate it. That actually turns out to 695 days worth of listening to music on Spotify, so quite a bit of time there. One of you reported that you have an irrational fear of elevators, and I wonder what's... What I also wondered, though, is one of you reported that you hate stairs, so I don't know what's going to happen if you get paired up on clerkships and how that's going to work. Let's see, one of you has shared that you've made it through life without seeing a movie of Harry Potter or Star Wars. Someone shared that they love to surf, but they're a bad swimmer, so hopefully you're a good surfer and don't have to worry about swimming in the water there. Let's see, and a personal goal of mine is actually to meet several of you who have hobbies that I share. One of you mentioned that you have a pizza oven. So just to let you know, my brother owns a pizza shop, so if you need dough when you're too busy to make that studying, let me know and I'll hook you up and so that way you can still make pizza. Let's see, one of you shared that you've been hot air ballooning a couple times to get over your fear of heights. And as I shared at MedFit, hot air ballooning is a passion of mine as well, so we'll have to talk about that. And then 2 of you also shared that you are Disney adults. And I would say I'm a Disney adult as well, and so we might have to share stories about Disney parks. So hopefully I get to meet all of you as well, because you share a lot of the hobbies that I have. So that, again, is just a little bit about this class. We're gonna learn a whole lot more over the next 4 years. But now that we've gotten to know you a little bit better, now it's time to meet you each individually as we're presenting you with your white coat and you truly begin your path to becoming a physician. So thank you.
It is now my pleasure to begin the presentation of the white coats. Before we begin, I would like to take a moment to thank alumnus Dr. John Gray and his wife Shelley for their generous support in purchasing the white coats for the class of 2029. At this time, I would like to invite Dr. Plouth, Dr. Calvo, and Dr. Howard to the stage. Class of 2029, as I call your names, please step to the front of the stage to don your first white coat and sign the honor pledge. Let's begin. First row. Yesenia Ariana Aguirre. Nina Amoldova. Berna Ahmet. Hania Navarin Amezcua. Laiba Arshad. Neil Babu. Jonathan Baker. Tyler Barbary. Adam Barbieri. Ainsley Barrow. Dominic Benna. Ethan Biasi. Riley Campbell. Edward Carata. Christian Joseph Cooper. Chelsea Cox. Jason DeHoya. Rance Delmar. Natalie Dennis. Lexi Maria Diaz. Brandon Coy Duan. Josie Douglas Lafer. Yallison Espinoza. Phoebe Antoinette Diaz Bagawaga. Camille Fischera. Alicia Freed Doer. Gabe Gambleton. Raymond Gerardo. Mariah Lee Ha. Melanie Ha. Aaron Halligan. Brenna Hansen. Joshua Hartman. Abby Elizabeth Hayes. Jessica He. Spencer Hicks. Nicholas Haslick. Lene Joe. Omar Callie. Jackson Kalicki. Aryan Hassan Karimi. Neil Anshu Kemke. Oh Byung Kwan. Nadine Lagaya. Juliana Liu Lee. Jacqueline Eve Martinez. Shreyas Matharaj. Delaney McGannon. Demar Moore. Tommy Noonan. Saba Narasifar. Randy Owens. Amber Peak. Daniel J. Pendleton. Christopher Potts. Kenneth Bragmani. Scarlett Ramos. Elizabeth Schilling. Kate Schaefer. Sanjay Shankar. Gozde Shipman. Nayana Kaur Singh. Robin Jot Singh. Shruti Srinivas. Ozzy Taveras. Karen Tran. Vera Vaz. Britta Verhey. Benjamin Vinci. Aline Voskanian. Arnold Peiwei Wu. Alfred Yi. Miranda Yu. Miriam Park Yoon. Thank you, Dr. Plouth, Dr. Calvo, and Dr. Howard. You may return to your seats. Congratulations once again and best wishes to the class of 2029. But wait, there's more. At this time, I would like to welcome Devin Glenser, President of the Class of 2028, to come to the podium for the recitation of the Honor Pledge.
Thank you, Dr. Singer. As President of the Class of 2028, and on behalf of the current students at UNR Med, it's my pleasure to lead you in reciting the Honor Pledge. Class of 2029, please find the pledge on page 6 of your program, stand, and let us recite the pledge together. As you recite the pledge, say the words confidently, as this is a reminder of the commitment you are making to your future patients. On my count, 3, 2, 1. I will strive to maintain the highest standards of responsibility, integrity, and professionalism during my education and throughout my professional career. I will neither receive nor give unauthorized assistance on examinations or assignments, and I will approach my education with honesty and integrity. I will respect and support my classmates, colleagues, and teachers at all times. I will strive to acknowledge my limitations, strive to learn from my mistakes, and work to improve my skills to the benefit of my patients. I will strive to commit myself to a lifetime of learning and teaching both the art and science of medicine. I will strive to attend to all my patients with competence and compassion. I will maintain patient confidentiality and be tactful in my words and actions. I will honor the diversity of patients' experiences, cultures, and beliefs. I will recognize the privileges afforded to me as a physician and a physician in training and promise not to abuse them. I will use my knowledge to improve the lives of others and never to harm. I make these promises solemnly, freely, and upon my honor. Congratulations to the class of 2029, and welcome to the University of Nevada, Reno School of Medicine.
You may be seated. Thank you, Devin, and congratulations once again to the class. Before we conclude our ceremony today, I would like to take this opportunity to thank the Nightingale Concert Hall for the use of their beautiful facility and the contributions to this event. Thank you also to the Arnold P. Gold Foundation, who were the initiators of the very first white coat ceremony in 1993. for their ongoing support and for providing the humanism and medicine pins for the class of 2029. You sign them on your lapels. Students, you'll find a card in your coat pocket that explains the significance of this pen, a symbol of the compassion, respect, and empathy that are all at the heart of your future profession. Also, a special thank you to the admissions, student affairs, and marketing and communications teams for producing this ceremony, along with the many volunteers who contributed today. Now, I invite the class of 2029 to recess off stage and make their way to the lobby where they'll meet you. Thank you, and good evening.